Effective today, February 10, the island-wide curfew will commence at 8 p.m. instead of 10 p.m. nightly and end at 5 a.m. until February 24. The announcement was made by Prime Minister Andrew Holness as he gave Parliament an update on the government's management of the COVID-19 pandemic on Tuesday.
The gathering limit will be reduced from 15 persons to 10 persons, and this is nationally. So let me spend a little time on both measures. The curfew has proven to be the most effective measure, but it is the most expensive measure because of the impact it has on the economy and on business. But the curfew certainly helps to filter non-productive activities.
The Prime Minister says the security forces will be exercising greater vigilance to ensure that the curfew hours as well as other measures in the Disaster Risk Management Act are complied with. To date, more than 17,000 Jamaicans have tested positive for COVID-19. The highest daily numbers have been recorded in the last few days. Mr. Holness says the increased numbers being tested are as a result of island-wide surveillance and not random testing.
Meaning that we're not just going to see somebody in the street and say we're testing you or we're testing you. The basis of our public health response, whether it is for COVID or for dengue or for, it is the surveillance. And what we have invested in is to increase our capacity to go into communities and observe what is happening and report back to our health professionals and then make interventions in those communities. So we are able to tell you with great accuracy what is happening in St. Thomas. We see a cluster emerging and we move our resources into St. Thomas. We put all the resources around St. Thomas and we bring the situation under control. We are seeing less hesitancy towards being tested. I recall, Madam Speaker, when we started to do the mobile testing, when the buses were going into some communities, the people would just run and hide. I remember we were trying to do it in a community in Montego Bay and people just wouldn't come. Now, and in other communities. Now, Madam Speaker, persons are coming, asking when is the bus coming, I want to get tested. So that would also contribute to the increased numbers of persons being tested.
Mr. Holness notes that the rising numbers and the capacity of the island's hospitals to facilitate the number of people being hospitalized is concerning. He says the government cannot dedicate the entire capacity of Jamaica's healthcare system to COVID-19 alone.
The island-wide hospital census shows significant occupancy levels across the health regions. Currently, the Western Health Region is at 83% of capacity. The Southern Region is at 76% of capacity. The Northern Region is at 66% of capacity, and the Southeast Region at 59% of capacity. Additionally, there are a number of hospitals across the island that are at or above 90% occupancy levels, and this would include the Maypen Hospital, the Kingston Public Hospital, and Spanish Town Hospital. And those are our major hospitals, and they are at or above 90%. So there may be capacity in other facilities spread across the island, but it may not match where the population centers are. So what we are seeing here, having interrogated this data, is that there is need for a greater sense of urgency.
Responding to concerns regarding the new strains of the SARS-CoV-2 virus, the Prime Minister says samples have been sent abroad for testing.
The Ministry of Health and Wellness has advised that as part of their surveillance activities on new variants, they have sent off for genome testing, genome sequencing, 14 positive samples from travelers from the UK. And later this week, they plan to send off another 101 samples randomly selected by parish. The results from genome sequencing will give us better insights into how prevalent the new variants, if they exist, may be in Jamaica.
Mr. Holness says the recent surge in Jamaica's case numbers should serve as a reminder to all that the pandemic is not over. He is urging the public to be responsible.